Trochanteric bursitis is described as inflammation of the bursa right to the lateral side of the greater trochanter, with structures like the iliotibial band and glute max covering this bursa. Issues in the sliding relationship of these structures in relation to the femur is a primary cause of this bursitis. There is a condition called external snapping hip, which is where during the positions of flexion, internal rotation, or abduction, that the hip exudes a audible pop on the outside, often asymptomatic, could eventually lead to disastrous friction relationships that cause a continuous cycle of bursitis. People with snapping hip should avoid movements that create this snapping sensation or adverse friction that can lead to chronic and cyclical presentation of symptoms in the outside of the hip. General approach to this is assessing for tension patterns that would necessitate manual intervention to lengthen the muscles. Primarily here we're talking about glute max and potentially TFL. Populations where this is common are people who are experiencing or exploring deep sagittal plane motions, especially under weight. This can be deadlifts, deep squats, without the proper amount of post-care lengthening attention to these tissues.